In order to facilitate your discussion with parents following the hearing screening, the next few slides will address potential questions you might receive and how to appropriately address those questions. If parents ask you, "Why are you testing my baby's hearing?" you could respond with, "It's best to discover a hearing loss in your child as early as possible. Early detection provides an opportunity for timely intervention and may prevent delays to your child's speech and language development." If parents ask you, "How long does the hearing screening take?" if you're performing an OAE, you could respond with typically 10 to 15 minutes. If performing an AABR, you might respond with up to 30 minutes. If parents ask you, "Will the screening hurt my baby?" you can respond with, "No, most babies sleep through the screening and the procedure does not cause any harm." In some cases, the parents might refuse a newborn hearing screening. This can present a challenging situation for you as the healthcare provider, but here are some ways you can address that situation. Provide parents with written material on the importance of newborn hearing screening. You can also provide them with a list of hearing, speech, and language developmental milestones. Both of these materials, in addition to several other educational resources, are provided on the Training Toolkit page. All of these resources can be printed or sent to parents. You should also document the refusal of the screening in a chart. And finally, ask the child's primary care provider for assistance if necessary in educating the parents about the importance of hearing screenings. If the child passes the hearing screening in both ears, you can say the following: "We have completed your child's hearing screening and his or her results are a pass. It's always important to monitor the progress of your baby's development because your baby's hearing can change at any time. If you're ever worried that your child is having difficulty hearing or has a speech or language delay, talk to your child's doctor and ask for a referral to a pediatric audiologist." Some children will pass the hearing screening but display high risk factors for hearing loss. These risk factors will be covered in Training Video 5. In this situation, you might say, "We have completed your child's newborn hearing screening. He or she has passed. However, because of some medical concerns, there's a chance that your baby can develop hearing loss. Your child's hearing is critical in order for on-time development to occur. Your doctor can help to monitor your baby's hearing development and inform you when or if your child should have further testing with an audiologist." When the child needs to be referred to a pediatric audiologist for diagnostic testing, it would be appropriate to say the following: "We have completed your child's hearing screening. The results indicate that further testing needs to be completed. This is just a screen, and it doesn't necessarily mean your child has a hearing loss. There could be other possible reasons aside from hearing loss for why your child has referred today, but without further testing, we can't be sure of the reason. We will refer you to an audiologist for a full evaluation. The results from today's screening will be provided to the audiologist. We'll make an appointment with the audiologist today, and please be sure you keep the appointment for further testing." Here are some final helpful tips when discussing results of the screening with parents. Avoid using the words failed and deaf, as these words can provoke anxiety. For example, rather than saying, "Your child failed the screening," you should say, "Your child referred on the screening," or "Your child did not pass the screening." Remind parents that a hearing screening is not diagnostic and that further testing needs to be completed. However, it's crucial that you do not dismiss the importance of the hearing screening. Results of the screening need to be immediately addressed. As healthcare providers, we want to be proactive and not reactive. You can also inform parents about the importance of early hearing detection and intervention for maximizing the child's speech and language development and his or her communication abilities. Try to keep all of the information as simple as possible, but again, do not dismiss the importance of the hearing screening results. Referring back to our bundled approach, we have completed the scripts training and are ready to address the remainder of the acronym. Please continue to Training Video 5 to learn about these next 6 steps.